Hi, I'm Catherine from East Haldimand Hospice. Welcome to East Haldimand Hospice series of educational videos for caregivers, Walking in My Shoes. Topic 8, How to Give a Bed Bath and Attend to Personal Hygiene. People who are sick and weak and who are struggling to help themselves have the same priorities as you do. They want for themselves what you want for yourself. To maintain a sense of dignity and privacy as much as possible. To maintain a sense of control as much as possible. To be treated with respect, sensitivity, and an awareness of their feelings. And to avoid being a burden to their family and friends as much as possible. By focusing on the priorities, the experience of providing a bed bath will be more pleasant for both you and the person you are caring for. Helping with a bath or shower. When the person can go into the bath or shower, you may find the following tips useful. Before the person goes into the bathroom, have all the things they will need ready. Run the bath and check the water, or the person's preferred temperature. Have the soap, washcloth, shampoo, and other items such as razor blades, creams, etc. nearby. Have the towels within easy reach. If possible, put the towels in the dryer for 2 minutes to warm them up so the person can feel warm when they dry themselves. Having people to stand up or sit, lie down can be very difficult on your own body. So it's important to remember all the rules of lifting and leaning over that you were taught in school. Remember to bend at the knees when you are picking up an object and keep your back as straight as possible. Remember as well that the closer you are to the person or object you are lifting, the less strain you put on your lower back, arms, and legs. Some regular squatting exercises will help strengthen your legs and lower back. If you get quite sore by helping someone get up or down, ask your family doctor, visiting home nurse, occupational therapist, or chiropractor to give you clear instructions on how to lift someone properly so that you do not continue to hurt yourself. Help the person into the bath or shower, making sure you bend your knees slightly and keep your back as straight as you can. You may want to put a long towel under their arms to help lower them into the bath. If the person is able to help themselves more, you can help them sit on the side of the tub on a warm, non-slip towel or mat. Swing their legs over and help them to ease into the tub. Reverse the procedure when they want to get out. Make sure the bath or shower has a non-slip bath mat. If the person needs help for weeks or months, it may be wise to adapt your bath or shower with handles and other safety aids. Check with an occupational therapist or physiotherapist through your home care program. If the person prefers a shower, rent or borrow a bath chair or use a water-resistant chair so they can sit down comfortably. Your home care program may be able to arrange this. The person may feel more comfortable if their genital area is covered. You can use a short apron or modified towel with Velcro tabs so the person has the privacy they want. How to give a bed bath. Remember to wash another person as if you were having the bath given to you. The bath is a form of exercise for the person being cared for, even if you are doing it for him or her. Even with you doing the moving and lifting of limbs, the person still must use their own energy to assist you. The first step is wash your hands and gather equipment. Wash your hands with warm soapy water if available, or with a hand sanitizer. How long should you wash your hands? Well, how long it takes to sing Happy Birthday is just about right. The next step is to gather the supplies that you need. A flannel sheet to cover the person, 2 washcloths, and 2 towels, One set for the face and body, another set for the genital area. Soap and soap dish. Moisturizer, clean pajamas, nightgown or clothes, underwear and socks. Incontinent brief if required. Clean sheet and a basin of warm water. Note, Vaseline is not to be used if a person wears oxygen. Powder should be avoided as it is a lung irritant and if spilled can cause a slippery floor. Next, prepare the person to be washed. Remove the blankets. Check the basin of water for warmth, not too hot, not too cold. Wet the washcloth. Many people prefer no soap on their face. Wash the person's face, neck, and behind the ears. Wash the face first, making sure to carefully wash the eyelids, wiping from the inside corner outward. Wash behind the ears and the back of the neck. Rinse the cloth out and dry well. Next, wash the arms and hands. Remove the pajamas. Uncover one side of the body first. Soap up the same washcloth that was used for the face. Lay a towel under one arm of the person. Wash the arm and hand and between fingers. Rinse off all the soap and dry well. Wash the armpit. It's a good idea to place the person's hand right in the basin of warm water. Next, wash the chest, abdomen, back, each leg, and then feet. Wash the chest first, then the abdomen, leg, and foot. Rinse as many times as needed to get all the soap off. When drying, make sure the skin under the woman's breasts are dry. You may want to use some moisturizer on the back, arm, leg, foot, or other dry skin areas to soothe and comfort the person. Remember to be gentle. Now, repeat those steps on the opposite side of the body, first covering up the washed side. Then wash the genital area. Using the second washcloth, clean the genital area by folding the washcloth like a mitt and wipe the area with a small amount of soapy water. Rinse and dry thoroughly. Never use the water for washing after you have cleaned the genital areas. Next, put the patient in clean pajamas or clothes. Dispose of the water and washcloths and towels. Put the washcloths and towels in the laundry. General hair care. People need their hair clean, combed and brushed at least twice a day, cut and set. The condition of one's hair often tells visitors and the person themselves how well they are doing. Clean and groomed hair is important for good health and feeling good about yourself. Dry shampoo. You can wash someone's hair using dry shampoo like a commercial dry shampoo, cornstarch, or natural unscented talcum powder. For someone who needs their hair washed in bed, dry shampoo can sometimes be a quick alternative to a normal wash. Do the following. Place a towel under the person's head. Sprinkle powder on the scalp and massage the hair and scalp gently. Brush the powder out of the hair with a slow, even stroke. If the hair is tangled, hold it firmly near the scalp before brushing through to the end. Wash the hairbrush after each dry shampoo. Wet shampoo. If the person needs a normal hair wash but cannot use the bath or shower, you can wash their hair in bed. You will need a plastic sheet to protect the bed, a waterproof cape like in a hair salon, or a plastic garbage bag with a hole for the head and cut along the sides to make a cape, a jug or pitcher of warm to hot water, several if the person has long hair, a bucket or large basin to collect water. There are no special shampoo trays available through some drugstores, a washcloth or small towel plus 2 larger towels for drying, pillows, shampoo, comb or brush, and a hair dryer if needed. To help the person wash their hair if they are not able to do themselves, you may want to put a towel or plastic sheet on the floor under the bucket to catch any spilled water. Have the person lie on their back with their head over the side of the bed. Adjust the pillows, covers, etc. so that they're comfortable. Put the bucket or basin on a small table under the person's hair. Cover the area with the plastic sheet and have the person wear their cape, with the back side covering the pillow rather than tucked under them. Pour warm water from the jug over their hair so that the water falls in the bucket or basin below. Put the shampoo into the hair and gently massage it to lather the hair and scalp. Rinse the hair with the remaining water. Dry the hair with a towel and then with the dryer if necessary. Empty the bucket and tidy up the bed. Remove the cape and plastic sheet. Place the other dry towel on the pillow to soak up any moisture still in the hair. Other tasks like setting or coloring the hair can be done as well. Personal hygiene. The person that you are caring for may be susceptible to colds and viruses that visiting family and friends carry into your home. Here is a list of the chain of infection. Organism. This is where it all begins. Any microorganism can cause an illness, including a bacterium, a virus, a parasite, a fungus. Organisms can cause an infection because they have the ability to multiply and grow, and they have the ability to enter tissue. Reservoir. This is the place where the organism resides, thrives, and reproduces. It could be on a toilet seat, in mucus droplets, in a glass of water, in human feces, on a doorknob, a tissue. Portal of exit. This is the place where the organism leaves the reservoir. It could be a nose, mouth, blood, or vomit. Transmission. This is the means by which the organism transfers directly or indirectly from one person to another. If the mucus droplets that are shot out during a sneeze and land on you, then the organism has transferred directly to you. The same can happen with feces or blood or urine or saliva, or the organism can be transferred to you indirectly if you pick up a dirty Kleenex or a used drinking glass. Portal of entry. This is the place where the organism enters your body, such as an open wound, a feeding tube, a urinary catheter, a mouth, or a nose. Vulnerable host. Several factors make a person a risk or more susceptible to the infection, including age. Young and elderly people are generally more at risk. Underlying chronic conditions such as illness, diabetes, asthma, conditions that weaken the immune system like HIV, chemotherapy, feeding tubes, open wounds, lack of sleep, poor nutrition. How can you protect the person and yourself from getting sick? The way to stop germs, infections, virus, bacterium from spreading is by breaking this chain at any link. Do wear gloves whenever you come in contact with anything that is ooey, gooey, wet, not yours. Don't touch your face when wearing contaminated gloves. Don't touch surfaces when wearing contaminated gloves. Do wash your hands frequently. Do stay up to date with your vaccines and flu shots. Do cover coughs and sneezes. Do clean and disinfect the environment regularly. Do follow safe injection practices. Do follow prescriptions exactly. Do use dishwashers with sanitized settings. Remember these simple rules. Will your hands be exposed to blood, excretions, secretions, contaminated towels or linens? Then wear gloves. Will your face be exposed to coughing, sneezing, a spray? Wear a mask. Wash your hands often. Here's how you can make a simple household disinfectant. 1 part water, 1 part rubbing alcohol or hydrogen peroxide. Spray and leave after you've cleaned a surface. Use only where required. Example, points of contact in the bathroom. Rubbing alcohol at least 65% USP in order for it to qualify as a disinfectant can be mixed with water. Hydrogen peroxide, naturally occurring bleach used in oxy powders. Use oxygen to break bonds between dirt and bacteria and the surface they are on. It's a great disinfectant, stain remover, and natural whitener. Now, how to give a simple massage. People dealing with a variety of issues, some that are physical and some that are emotional, can benefit from a simple massage. Very slow, gentle, and gently applied techniques are the most appropriate. The overarching goal is to provide comfort without doing harm, and with all massages, tailoring the massage to the individual. Remember, the massage should not be painful. It should feel good. Be sure to check if the pressure is comfortable. Don't massage anything that feels bony. Bones don't relax. They also tend to be very sensitive. So everything you massage should feel relatively soft. This concludes our Topic 8 video, How to Give a Bed Bath and Attend Personal Hygiene. This video has been made possible due to the generous grant provided under the Resilient Communities Fund of the Ontario Trillium Foundation.